Well, we founded Third Rock in 2007. In the early 2000s, biotech and pharma had really stopped developing to a large extent very important big ideas for the future.
The biotech landscape in Boston and San Francisco had not really reached the stride that it's reached today.
Science, at the same time in academia, was exponentially growing with regard to its new ideas, genomics and gene therapy and CRISPR technologies and many others.
And we kind of scratched our head when we saw innovation exploding in academia. And at the end of the day, we thought the venture industry lost a lot of courage, because that's what we're supposed to do. We're supposed to be the high-risk capital that goes after the big ideas, and it just got too safe for too long.
So what Third Rock did, in my opinion, and the three founders kind of took their time fooling around, but they finally got to the right answer, which was, how can we redo the biomedical company building model?
When so many other people in venture capital were running for the exits away from biotech, TRV said, we're prepared to take on really hard challenges, important technologies, tough physiology.
By bringing the best science together with new ideas from academia and bringing that together with a team at Third Rock, we could take those ideas through our entrepreneurship and build important companies that would make a difference for patients.
It allows somebody like myself with some knowledge of clinical medicine and science to dare to believe in something.
I mean, I know this is a little bit of a cliche, but I guess so is a 10-year anniversary video. That's a bit of a cliche too. In some ways, the startup of Third Rock is the best startup that the three founders and the team have ever done. That's a good line. I'm glad I thought of that.
That's a good one, Bill.
This company has imbued itself with a certain set of principles.
Those core values, they really are the foundation of who we are and the pillars that support everything that we do.
It's all about the marriage of great science and great people. We believe in group genius here. It's an important part of who we are. The principle of group genius actually is about creativity, and how in creativity you really do need to leverage the thoughts and minds of others.
So we're always talking about the integration of business, medicine, and science, and how do you bring together those three different perspectives? And it's kind of like the Rubik's Cube, of where you're always sort of changing it around. Everyone has tremendous respect for each other. I think one of the hallmarks everywhere through our companies and through Third Rock is the ability to rely upon a greater ecosystem and a divergence of thought and divergence of talent.
I think other companies have maybe a single personality that drives a lot of what happens in those venture firms. Third Rock is completely different. It's really a company building, team-based approach.
Successful entrepreneurs rely on great teams. Entrepreneurialism, self-starting, big vision, and ability to work with a team is one of the key things that has made us successful over the last 10 years.
How I think about measuring success for TRV is really, do we create value? Do we create value for investors? Do we create value for patients? Are we creating value for our partners?
Partners today think of us as a go-to firm to talk to about innovation and the next new companies that are entering the marketplace.
To me, the core value that most embodies Third Rock,
I'd say the first one is patience.
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 It's central to everything we do.
The way every single member of the Third Rock team lights up when they've done something for patients is just extraordinary. They're each and every one turned on by what they're doing for patients.
When you know that people are suffering, can't even leave their house, can't even engage out into the outside world, and they take this medicine that has come from a company we've built, and you see it do something utterly remarkable for that patient who can now leave the house, that can now engage the world, that is what we are most proud about.
We start with integrity. The core of everything we do is integrity.
You have to have employees who pay attention to the data, who tell the truth about the data. That's a big issue. Because if you don't take the high road on things, then nothing else works, nothing else matters.
Yeah, of course, you got to create returns for your investors, et cetera. But that's not at all the mechanism or the genesis of why Third Rock was created. Focus more on building important companies with really smart people, and then good things will happen.
Having a positive attitude enables you to think about things slightly differently.
They have a great group of people. in my opinion, that's why people want to work with Third Rock.
We truly are an eclectic group. That adds a lot to our exchanges, it adds a lot to our creativity, and that's something that makes us, more than just an investment company.
Since we began a decade ago, we've developed 45 companies in areas like Boston and San Francisco.
We have 50 plus programs in clinical trials. We have several products on the market.
Those products at this point now reaching over 100,000 patients.
And fortunately, for some of them, we're making a real difference.
Seeing companies go public, seeing companies have great data readouts, seeing drugs get approval, I would argue the next 10 years will probably be better even than the past 10 years.
It's the tip of the iceberg, and the future will really allow us to help tens of thousands, if not hundreds of thousands or millions of more patients around the world.
We are in a golden age of science and translational medicine in understanding diseases and having the tools and technologies to make a big difference.
I believe 100 years from now, people will look back at these decades as some of the decades that made the biggest difference in humankind.
What excites me most about the future of biomedical science is the kind of place where we are at Third Rock, is the ability to cure disease. Not treat it, but cure it. And it really has never happened before.
To me, a deep understanding of genetics and medicine is a great force for realizing that we are all brothers and sisters, and the argument to help each other is ever stronger in my mind when I think about progress that has been made on these diseases.